Referral form validation. Validation is a set of rules that can be applied to referral form fields or checkboxes, according to specific criteria. Validation on referral forms identifies whether the patient being referred meets the required medical or demographic criteria for the specific referral. For example, if referral form criteria require patients to be 18 years and older to be referred, and the patient being referred is currently only 16, depending on the validation in place and the strictness of the input validation rules, errors or warning messages will appear to inform the user of the patient's unmet criteria. DXS offers two different types of validation functionalities: load validation and complete validation. Load validation. When opening a referral form, load validation will use the patient's pre-populated details to validate the field information according to the specific criteria in place. When the validation criteria are not met, fields with unmet criteria will be highlighted in yellow. The first time a user wants to edit the referral form after the patient data has loaded, load validation will present a warning message, for the first and only time, if there are any yellow fields present. This warning message will inform the user of the unmet criteria within the referral form. The warning message text can be customized to suit the referral preference before the form goes live. When clicking OK, the warning message and the validation failed message below the form will no longer be present. The referral form will not restrict any documentation from being saved and referred, unless it was originally requested for a strict rule to be added on the fields, and criteria have not been met. When clicking on the yellow highlighted fields, an invalid input message, with an input tip, is present in the field to help provide more information about the field's validation criteria. The invalid input message, and input tip text, can be customized to suit referral preference before the form goes live. Without strict input rules on the fields or checkboxes, the referral form can be saved back to the patient record and referred. Yellow fields will still be present in this instance, however, there will be no restrictions. When the criteria on a referral form have been met, no yellow fields will be present, and the form can be saved and referred onwards as per normal. Input rules can also be set in place on individual or all fields. If a rule is set to strict, users will not be able to save the form with any unmet criteria. Once the rules have been set to strict, any unmet criteria within the referral form will prevent it from being saved back to the patient record and referred onwards. When trying to action either of the before mentioned, the user will be presented with an error message. Complete validation. Complete validation is stricter than load validation. Unlike load validation, complete validation requires not only the patient data pulling through to meet the criteria, for example, a patient being 18 years of age or the BMI data to be above a certain value, but also, for certain actions within the form to be completed, or a mandatory section to be filled out. When a form has populated with the patient's details, and the user tries to save back to the patient record, the user will be presented with an error message if there are any unmet criteria according to the rules in place, and as a result will not be able to save the form. A patient's information could all have populated correctly, but the referral would still be restricted from being referred, due to certain actions still needing to be actioned within the form. An example of this would be confirming consent to information sharing gained from the patient, and a field needing information to be filled before proceeding with referring the patient. This error message informs the user of unmet validation criteria, and that the explanation of the unmet criteria can be found in the yellow pane below the form. Only after everything required has been actioned, and all the patient demographics have met the criteria, will the user be able to save the form. Once the criteria have been met, and all actions have been taken, the form can be saved back to the patient record and referred onwards. Should you experience any problems, please do not hesitate to ask for assistance. You can contact our service desk on the below details. Thank you for watching.